towards another microscopic feature, which is actually the size of the gingiva. So basically the size of gingiva is basically related corresponds with the total of the bulk of cellular and intracellular elements. Basically it is actually that the size depends on how much elements or cellular or intercellular elements are present and how it is actually vascularized. Okay, and when there is a change in the size of the gingiva, so basically there is actually related to any gingival disease. Okay, now contour is another. The shape or contour of the gingiva varies considerably, and it actually depends on the teeth. The shape of the teeth is then how the teeth are aligned in the arch. Location and size of the area of the proximal contact means that the location and the size of the proximal contact, the dimensions of facial, lingual, gingival abrasures, that the dimensions of the gingival abrasures are. Okay, so basically the contour depends on the shape of the teeth, the alignment of the teeth in the arch, the location and the size of the contact points, then the dimensions of the gingival abrasures. Okay, you know and we know that the margin gingiva envelops a teeth in a collar-like feature which is scallop outline on the facial, lingual both surfaces. So the shape, so the gingiva has a scalloped outline. Okay, it forms a straight line along the teeth with relatively flat surfaces on the teeth with pronounced mesodistal convexity. Means they are saying that when they have the flat surfaces, it is actually when teeth are mesodistally convexed. Like for example, you can see in the maxillary canines and teeth in the labial virgin. The normal arcuate contour is attenuated. So basically it is actually attenuated means prominent, and the gingiva is located further apically. On the teeth on the lingual side, the gingiva is horizontal and thicked, means that the okay. For example, you can see in the diagram like here, the thick and shelf-like contour of the gingiva on a teeth in a lingual virgin is aggravated by local irritation, means there's a plaque accumulation, so actually the contour is also disturbed. Okay, now basically the gingiva becomes horizontal and thickened. In addition, the gingival tissue biotype varies significantly. A thin clear gingiva which is found on 1/3 of population and primarily in females with the slender teeth. That is narrow zone of keratinized tissue, means they have actually the narrow zone of keratinized tissue, whereas a clear thick gingiva with a broad zone of keratinized tissue is present in 2/3 of population and primarily in males. Okay, so in females there are thin clear gingiva in 1/3 of females and a narrow zone of keratinized which is actually a narrow zone of keratinized tissue, whereas actually a broad zone of keratinized tissue and thick clear gingiva present in 2/3 of the population, that is basically males. Now moving towards the shape of interdental gingiva. This interdental gingiva shape is also depend on the contour of the proximal tooth surfaces, means the contour of proximal surfaces, again the location and shape of the embrasures. Okay, now the proximal surfaces of crowns are relatively flat and phasolingually the roots are close together also. So the interdental bone is thin mesodistally and the gingival abrasures and interdental gingiva are narrow mesodistally. So basically they are describing the shape. When the proximal surface of the crowns are flat phasolingually, means the proximal surfaces are flat phasolingual and the roots are close. The interdental bone is thin mesodistal and the gingival abrasures and interdental gingiva is narrow mesodistally. On another side, when proximal surfaces that are far away from the area of contact, so the mesodistal diameter of the interdental gingiva is broad. Here it was actually the interdental gingiva was narrow, but here is actually broad. The height of the interdental gingiva varies with the location of the proximal contact, also means that the height of the interdental gingiva changes with the proximal contact. Thus, in the interior region of dentition, the interdental papilla is pyramidal. Very important point. That interior region, the interdental papilla is pyramidal, whereas papilla is more flattened in buccolingual in the posterior side, which is actually molar region. Okay.